Obstetrics. With regards to our patient, we definitely need to find out a few questions to the mom that's delivering right now. And we need to understand that it has to be an active labor, so we have 3 different stages. The first stage is the state of contractions, and these contractions will continue to develop and build. They'll get short, longer in duration with shorter pauses. And during that time, there may be a bloody show, or that the membranes will rupture and there'll be a gush of water that comes out. But during this time, we have a lot of time to prepare. This is the stage of active labor that takes the longest, the first stage. It's not until we see active crowding where the head starts to come through the vaginal canal. This means that the baby's cranium or head has had to pass through the cervical opening, and that had to dilate and stretch. So the second stage is when the head starts to deliver till the baby or infant is delivered, the neonate is delivered, and then the third stage and final stage would be from the delivery of the baby to the delivery of the placenta. So anyway, now let's go back to some of the questions. So we're going to find out the age of our patient, we're going to find out all the past medical history, as well as the more important things about the labor. How many weeks? We'd like a baby to be at least 38 weeks, 40 weeks, because that would mean that the child has had the opportunity to develop the lungs. But if the baby is preterm, that just makes this more of an emergency, and we need to notify the hospital early on. Now, besides finding out the weeks and the due date, we also would like to find out if this is a single gestation or multiple gestations, or multiple births or multiple babies, as well as finding out whether or not the mom has had prenatal care. Now we also want to find out whether or not the mom has had been pregnant before, so we ask her about the gravida. Then we'll ask her for how many live births she's had, so parity. And even though we're going to also ask for live births, we'll ask for abortions, and this could be elected or spontaneous abortions. And we might want to ask even at what date these children that have been delivered, how old they are at this current time. This was also, as well as the obstetrician and the hospital that the patient is supposed to be delivering at. So those are just some of the common questions. As the child then if the mom is in labor and you see some active crowning, we would like to get an obstetric kit. This is just a commercial kit. Just get this ready, place some chucks underneath to trap whatever fluids that are leaking. Sometimes it's even easier to place a large trash bag underneath, then place this on top so that everything is contained. We'll go ahead and drape mom up. And then we also want to provide some type of, for modesty, to keep the area, unless we're actually monitoring it, to give the mom some privacy. Now, as we go ahead and monitor the mom from her contractions, we're going to ask her to breathe through the contractions and then to relax when she's not having contractions, because once we deliver, we need to make sure that we have everything else out of our kit ready to go. Now, we'll talk about the actual delivery process in class, but just to go through it, make sure you set up your kit in the way that you need to. Some important things are going to be your umbilical clamps. You'll need to have 2 so that you can clamp one about 6 to 8 inches above from the baby, and then 2 inches in between. So that's where we're saying 6 inches, and then 2 inches above and 8, so 6 and 8. And these are 2 clamps, and in between here is where we would cut. You're going to need a bulb syringe so that you can suction out. We're suctioning out the mouth and then the nose of the infant, so that when they start to breathe, they don't inhale or aspirate any of this contents. A couple other things. So there's going to be a clear trash bag in there, and there's going to be a white bag. So the white trash bag is for everything else to be collected. The clear trash bag is to contain the placenta that then separates from the uterus. So we want to make sure that that is placed in here, and that we monitor everything. So make sure when you set up these kits, it's not necessarily going to be placed in between the legs. We probably place this somewhere else. Keep everything organized so that when it's time to use it, you know where everything is. Again, once the baby then is delivered, we would do other things. We would do things that would dry, warm, and stimulate to make sure that the baby starts to wake up and starts to breathe on their own. At the time of birth, we would go ahead and take our 1-minute APGAR score. And as we dry, warm, and stimulate and position, we then go ahead and also, at the 5-minute mark, do our 5-minute APGAR score. And what we want to do is we want to hope that the mom is going to have a problem, a less than problematic delivery, and that the infant here will continue to maintain all vital signs.